We will go live in about 30 seconds.
Hello, can you hear me?
Loud and clear, Governor.
Good. You know what I could do next? Move the
About
slide.
another about 10 or 15 seconds and we'll go live. Good afternoon, everyone. I'm Nirav Shah from the Maine CDC, and I'm delighted to be joined this afternoon by Governor Janet Mills, as well as Commissioner Jean Wambrew from Maine's Department of Health and Human Services, and Commissioner Heather Johnson from Maine's Department of Economic and Community Development. I'd like to, at this time, now turn things over to Governor Mills. Governor?
Thank you, Dr. Shah. Thank you, Dr. Shah, and I'm proud to have some members of this esteemed team on the Zoom with me today. They've been an invaluable asset to me and to the state of Maine during this pandemic. Well, yesterday, the state of Maine reached another vaccination milestone, as you probably heard, having delivered at least one shot of the COVID-19 vaccine to more than 70% of Maine people ages 18 and above, according to the US CDC. This is the president's goal for July 4th. So we're reaching this goal 53 days early. Maine people, our medical professionals and volunteers across the state, Maine DHHS, the National Guard, Maine CDC, they all deserve a great deal of credit for this achievement. And Maine people who have showed up in droves to get vaccinated and feel free again to do things as they would like to do. So thank you, Commissioner Wambrew and Dr. Shah in particular. Our nation-leading effort to get shots in arms has proceeded at a faster pace than anticipated. Although we're not slowing down, we're not dropping our guard. But it is appropriate now, we believe, to update our public health protocols ahead of schedule. Previously, under the Moving Maine Forward plan, on May 24th, we planned to lift our indoor gathering capacity to 75% and change the outdoor gathering capacity to 100%, and physical distancing still being required. Well, today, I'm announcing that effective May 24th, Maine will lift capacity limits and requirements to physically distance in all public outdoor settings. And we'll lift capacity limits for public indoor settings on the same date. And we'll lift physical distancing requirements, the famous 6-foot distancing requirement for public indoor settings, except in instances where people have to remove their mask, like when they're eating or drinking indoors at a restaurant or bar, an indoor restaurant or bar. We're maintaining the requirement to wear masks indoors to help reduce potential transmission. And as you know, masks are already not required outdoors. So these changes align with the latest science, and they make sense for Maine at this stage, I think, given the percentage of our population that has been vaccinated. I want to be clear, we're still living through a pandemic, and these changes don't come without some risk, especially for those who remain unvaccinated. Please, I beg you, use common sense. Please protect yourself, your families, your communities by getting vaccinated. We continue to review our protocols every day, every week, but the simple fact is, the more people get vaccinated, the faster we'll be able to get back to normal as a state, as a society. If you haven't been vaccinated yet, please get your first shot between now and Memorial Day, and you can get a voucher for a free hunting or fishing license, or a day pass at one of our great state parks, or a gift card to LL Bean, or a ticket to the Portland Sea Dogs, or pass to Oxford Plains Speedway. To find a vaccination site near you, visit maine.gov/COVID-19/vaccines, or call the Maine's COVID-19 Community Vaccination Line at 1-888-445-4111. It's 1-888-445-4111. Please, those of you who have not yet gotten vaccinated, please do so today. Thank you, and I'll turn things back over to Dr. Shah for questions.
Great. Thank you very much, Governor. We're going to turn to some questions from our colleagues in the media, and the first one of which goes to Patrick Whittle from the AP.
Thank you very much. I just want to make sure I understand how the mask recommendations square with the latest from the CDC. We just received guidance today, in fact, that vaccinated people do not need to use a mask in really any setting other than very crowded indoor settings. Is there a chance that the state of Maine could update its own guidance to reflect that? It seems like these two sets of guidance are sort of coming out at just about the same time.
I can begin by saying we'll review that guidance when we've actually got it in hand. I don't think it's incompatible with our guidance. I'm anxious to learn from the US CDC how they would distinguish between vaccinated and unvaccinated. Our rules are probably a lot broader. I think more applicable to the state of Maine, where we've heard from businesses and concert venues and the like that they'd like to see what we're doing happen.
Okay, terrific. And has there been any discussion about if the state is potentially going to play any kind of a role in vaccine passports or sort of?
I have not had such a discussion.
No.
Great. Thanks, Patrick. Let me turn to Megan at WMTW next.
Thanks for taking my question. It kind of hinges around our latest numbers, hospitalizations, and the fact that younger people are making up such a large percentage of new cases. And when we are dropping certain requirements for places that a lot of young people visit, they seem, it almost seems counterintuitive. So I'm just wondering, if that's a concern. Clearly it's something that's been weighed, but what's the rationale that you still feel comfortable doing this in light of those numbers?
Mm-hmm. Well, Megan, I can start, and others please chime in. I think, Megan, where I would start is just to recap what is changing and what's staying in place. What is changing is the distancing requirement, but what is staying in place, at least as for right now, is mask wearing. Mask wearing plays an important role, and notwithstanding the latest guidance from the US CDC, which, as Governor Mills noted, we have not received yet, mask wearing remains critical, regardless of the venue. It's also the case that vaccination rates are going up, and up, even among younger populations. So yes, there have been more cases in that group, but there are also more and more vaccinations in those groups, to say nothing of the already very high levels of vaccination in older Mainers, those in their 60s, 70s, 80s, and above. That's the group that has experienced the highest number of deaths. Having had them protected now, there's a much less likelihood that they might visit a venue, get infected, and pass away. So those factors, particularly the higher rates of vaccination and increasing rates of vaccination in younger Mainers, gives us more ability to move back into these indoor settings without the same distancing requirements as a year ago.
Would you say that vaccination demand is still on par with our supply?
Well, here's what I'll say right now. We definitely have the supply in Maine to satisfy the demand for vaccines that we have, even with the addition of adolescents aged 12 to 15, for whom the Pfizer vaccine is indicated. We have ample supplies of vaccine for that group, as well as those 16 and over who wish to get vaccinated. That, coupled with the incentive program that Governor Mills released, means that we hope more people take us up on the offer to get vaccinated.
Just lastly and quickly, I think some guidance from Governor Mills' office has said that there might be some updates to what's happening with schools later on. Is that the case? And is there anything that you can tell us about, will there be updated guidance in terms of distancing in schools?
Yes, there will be soon, not today, but soon. We're working on that.
Thank you.
Thanks, Megan. Over to Cindy Williams next at News Center.
Hi, Dr. Shaw and Governor Mills. Thanks so much for doing this. Couple of questions. If we are still social distancing indoors, say in restaurants and things like that, isn't that a de facto capacity limit? And given that we are hearing that the president is going to lift all such requirements for people who are vaccinated, is that something that will be revisited soon?
Well, it does present a capacity issue for indoor dining and drinking. It does, yes. Many restaurants and bars are now serving outdoors. And so this change frees them up at least to increase their capacity outdoors. In terms of distinguishing between vaccinated and non-vaccinated individuals, we're not proposing doing that. We'll see what the federal guidance says when we have it in hand.
Cindy, one footnote there. Governor Mills noted this change does not apply to places where people would be eating or drinking, because when you're doing that, you don't have your mask on for the most part. So in those venues, in those settings, the standard 6 feet of distancing continues to apply.
Okay. Also, shifting gears, the Beach to Beacon 10K just announced today that it is going virtual. They are erring on the side of safety out of a lot of thought, a lot of consternation over whether or not to do this in person or virtually. But they basically decided that they couldn't do the open air party, festive, fun stuff. And then today's guidance came out. What do you think of that decision in retrospect?
Let me start by saying we're asking everybody to use common sense. We're not telling people they have to gather outside or they have to gather in large groups close together, or they have to do anything in particular. Common sense is in the foreground of all of these decisions. And they made that decision. Other groups have already made decisions to cancel or forego big parades and festivals this year, and that's their prerogative. And that's based on their view of their situation and common sense too.
Yep, and I will just add, Governor, that there are some changes that are happening today, as the governor announced. There are some that were announced on March 3rd. So we did announce on March 3rd that we were lifting the outside gathering limit effective May 24th. We also updated our community sports guidance, which did allow for outdoor road races. We again urge caution, as always, to try to maintain distancing to protect runners and people who are gathering. But we appreciate the fact that many event organizers recognize that while we are at reduced risk, especially as more people get vaccinated, we're not at no risk. So we do appreciate that when some event organizers are looking at their particular configuration and trying to figure out what works, what can be done safely, it may not be able to be done in all cases. So that will be the truth until we get past this global pandemic. But we appreciate the fact that this guidance does allow for some new degrees of freedom in different types of settings, especially outdoor settings, for activity to occur.
Thank you so much, guys.
Thanks, Cindy. Over to John at WGME next.
Hi there. This question is for Governor Mills. Governor, we're hearing from many people who've already been vaccinated, and they're wondering why they aren't eligible for the same incentives that you're now offering people to get a vaccine. So are there any plans at all to expand any of these perks for people who already got their shots?
Well, you called it an incentive, and it is an incentive for people who haven't yet gotten vaccinated to get vaccinated. Clearly, that's what it is. No, we don't plan to do it retroactively. People who've gotten vaccinated all did so, I'm sure, for all the right reasons. And we're hoping people continue to get vaccinated for all the right reasons. And if an incentive works, we're applying incentives as well.
And Dr. Shah, just to follow up, I know it's already been asked, but we're getting a slew of questions in real time about the new recommendations from the US CDC about lifting their recommendation on masks indoors. So you're saying you haven't seen anything about this yet. When you do you anticipate that you'll match what the US CDC is recommending here in Maine?
When we do see it, we will review it carefully and proceed accordingly. But we just learned about it. And again, we have not yet received it or reviewed it. That's got to be step number one. Where we go after that, I can't speculate.
That's all from us. Thank you.
Great. Thanks, John. Over to Patty White next.
Thank you. In terms of lifting the requirement to wear masks indoors, can you just tell us, I guess, what are the benchmarks you'd be looking at to do that? I mean, there is that people are talking about the US CDC guidance, but what are you looking at that would tell you it's okay to do that?
To further lift some of the restrictions so as to not require masks indoors as a rule.
Or the physical distancing where people have to take their masks off?
When people are eating or drinking indoors. There's no specific benchmark that we're looking for. You know, we're looking at this day to day, week to week, seeing where we are in hospitalizations, deaths, cases, and vaccinations. The more people get vaccinated, the more likely we'll be able to lift any further restrictions sooner than later. So I can only urge those who have not yet been vaccinated to do so, and we'll be able to make more progress.
Patty, the other observation is understanding how it applies insofar as as it applies to folks who are only vaccinated. How do we delineate who has been vaccinated, and how do businesses and other venues apply that guidance to those who have been vaccinated versus those who haven't been? That's got to be a question that we think through. And just to update something I said earlier, I understand now that the guidance has been posted during the time where we've been on the air with everyone. So we are again going to study it and then go from there.
Okay. And then one other question, the Maine vaccination dashboard shows that 767 kids aged 12 to 15 have received a first dose of the vaccine. What's your take on that number? How close is that to what you were expecting or where you were expecting to be with the vaccine just being authorized this week?
That's pretty good, I think, for just having started.
Yep, and Patty, you know, again, those are numbers of folks who would have essentially gotten their shots on day one, on Wednesday, because the vaccine was authorized on Tuesday. First day of vaccination was yesterday. So I think that puts us in good position.
Okay, thanks.
Starting today, as a reminder, Patty, starting today, effective today, the various retail, commercial, pharmacy chains in Maine are also now offering Pfizer vaccine to that group at varying different locations across the state. With the addition of those commercial pharmacy chains coming online, that'll be more access points across the state. We hope that access translates to more vaccinations.
Okay, thanks.
Over to Kevin Miller next.
Great, thank you very much. Just a quick clarifying question, and I'm pretty sure I understand this. So we're looking at the outdoor gatherings, indoor restaurants, bars, things like that. They're still going to have the space restrictions, but if they have outdoor seating, there's not going to be any capacity restrictions on outdoor seating at bars, restaurants, etc. Right? So we can go back to having kind of tables packed, you know, side by side like they used to.
I'll begin. So outdoors, I think what we do know is that studies have continued to come out that show the risk of transmission outside is very low, be it the air circulation, UV light, the nature of transmission. We just have increasing strong evidence that activity outdoors is safe. So we are removing that 6-foot distance between tables at outdoor restaurants, adding to what we had already done, which is lifting the 100% capacity at outdoor restaurants and other types of gatherings. I would note, though, that for the indoor restaurants, where there was a 75% capacity limit that would begin on May 24th, right now is 50%, that will go away. So it'll be 100% capacity beginning on May 24th, but we will still say, because you are taking off your mask to eat or drink, that those tables should remain 6 feet apart.
I will say, certainly from an economic perspective, right? This continues to be these steps forward that we're trying to take to continue to create capacity for businesses while still making sure that we're protecting public health, and that balance and that line is really critically important. So this is just this good next step forward in that work.
Okay, great. And this question might be for Dr. Shaw or Governor Mills. Obviously, we're headed into what people hope is going to be a very busy tourism season with lots of folks up here. And Dr. Shaw, you kind of touched on the challenge of this federal guidance on wearing a mask if you're vaccinated. How do you differentiate between someone who's vaccinated and someone who's unvaccinated, especially if you're a business? That seems like that's going to be a challenge, and I imagine there are people that are going to be unvaccinated that don't want to wear masks that are going to do it anyway. So how are you guys going to be looking at that when you decide whether to follow the U.S. CDC guidance?
Well, let me start by saying, the guidance just went up online in the last few minutes. We haven't studied it in detail. We're sticking with what we're saying today because we think it's best for Maine's economy and Maine's public health needs right now. And we think that keeping the same rules across the board is a smart thing to do. We're opening up an awful lot of venues now by doing this. An awful lot of situations and settings are going to be able to do business and invite the public in like they haven't been able to for a long time. So we're pleased with that, but we're also concerned about indoor settings of all sorts, and whether or not somebody can individually determine whether somebody else has been vaccinated or not is up to them. Whether they want to follow that rule individually as a private entity, up to them. But we're not drawing that line, not at this point.
Great, thank you.
Thanks, Kevin. Yep, thanks, Kevin. Over to Ashley at WAGM next.
Hi, Dr. Shaw. I believe this would be for you. Up here in Aroostook County, we have a lot of Canadian viewers. And over there, the vaccine approach is to get everyone at least one vaccine. We've heard from people who have gotten their first shot and they have either no idea when they'll get their second or their appointment is months away. I know you've talked about the importance of getting the second shot in the time recommended. I'm just curious your thoughts on that approach and just wondering how effective it is.
Yeah, Ashley, there's other countries that are taking a similar strategic approach as well. The UK and other countries in Europe. There are data that are now starting to come out about how these different epidemiological approaches are faring. What the second shot does is really fortify the immune response that you get from your first dose. So it's not that it makes it necessarily more effective or stronger. It just makes it more durable. It makes it last over a longer period of time. That's really what the second shot gets you and why it's so important to get that second shot. Now, the timing of that second dose is what's at issue here. Should it be at day 21 or 28, as is done in the United States, or could it be extended a bit further on? At this point, Ashley, I don't think we have all the data to really say for sure what the trade-off was in delaying that second dose versus giving more people their first dose. I have a feeling this will be a topic that epidemiologists and schools of public health study for quite some time.
I will add that, I have written to the powers that be, as well as members of Congress have also written, asking the Canadian government and the federal government to open the border between Canada and the United States so Maine can enjoy our Canadian visitors again and be able to go across the border as we did before.
Thank you.
Thanks, Ashley. Over to Emily at the Sun Journal.
Hi, good afternoon. I am curious how these new reopening standards and guidelines might change on a county to county basis. So for example, in Androscoggin County and Oxford County, we've talked a lot about how those numbers have been fairly high compared to the rest of the state and have lower vaccination numbers. So would there be any possibility, say in 2 weeks, we see cases go up in those counties, that the state might roll back those guidelines in those specific areas?
Let me start by saying we haven't considered that because, look, summer's coming and people are traveling freely from town to town, state to state, county to county. I'm not sure that a geographical distinction would make a lot of sense at this time. People do get vaccinated anywhere in the state, no matter where they're from. So residency is no longer an issue or restriction or anything. So I don't think a county by county distinction in terms of restrictions would make sense at this time.
Over to Amy Brown next.
Thank you. So just to clarify the expectations for indoor public settings that aren't restaurants or bars, like retail shops, grocery stores, is it that if distancing is not possible, masks are required? And how would that apply in a setting like a grocery store, for example?
The distancing rule is being lifted, plain and simple, except for restaurants and bars where you're eating and drinking, which is what you do there. The distancing rule otherwise is lifted and the capacity limits are lifted. So in terms of retail, grocery stores, other such venues, theaters and whatnot, the restriction is mask wearing because that's what the science tells us is the most likely thing, the thing most likely to reduce transmission. Mask wearing indoors, except for eating and drinking. So as a general rule, that's it.
Okay. Thanks. And I think this is probably for Commissioner Johnson, but are other items on the checklist going to be updated? For example, in shops, the dressing rooms are still closed. That was the one thing that initially came to mind, but other things like plexiglass partitions. Is there anything else that other indoor public settings can expect to see updated?
Amy, thanks for the question. And Dr. Shaw or Commissioner Lambert, please jump in because those are really primarily a public health activity. We work closely with them to try to develop that. We do expect that there will be some other changes coming and the checklist will be updated by next Friday.
Great, thank you.
Great, thanks, Amy. Over next to Jessica Piper.
Thank you, Dr. Shaw. We discussed a little bit yesterday how case numbers are still relatively high and hospitalization numbers are still relatively high. You said it's more young people. Are those factors concerning to you all as we, state moves forward with these changes? And kind of related to that, what can be done to ensure more accessibility for vaccinations, particularly for younger people who might be working or having trouble?
Sure, I can go ahead and start there, Jessica. We'll start on the access piece because that is really critical. I think we've as you're aware, we've taken a lot of steps in recent weeks to make vaccination the easy choice for as many working people. That includes things like walk-in or drop-in hours, making sure that as many sites as possible have early morning or evening hours or have hours that correspond with shift changes. Again, for working people to make it as easy as possible. And even though vaccines have been available at no cost throughout the vaccination, it just bears repeating once again that COVID-19 vaccinations are at no cost to the patient throughout the process throughout the state. Now, we know that there are still potentially access challenges, notwithstanding some of these changes. We've activated every pharmacy chain in Maine to be able to give COVID-19 vaccines at different schedules, at different throughputs, but we've activated them. And we're also, again, extending the tenure of the mobile unit to bring vaccination to places that may not have had as many opportunities. Sites like Rangeley, sites and other places in York County, in Pittsfield, places that we know there are concentrations of working folks, younger folks. So we're doing everything we can. The incentive program helps that as well. For folks who are right there in the middle, on the margin, not sure if they want to get vaccinated or not, this is hopefully a nudge that will drive them in that direction.
And so the other half of that, are you concerned at all about the high case numbers and the higher hospitalizations? So,
Yes, that certainly remains a concern, coming as it does from rural counties among younger folks with longer periods of duration. But again, even within that group, vaccination rates are continuing to go up. That's a good sign. We hope that the steps that I outlined a moment ago will continue that progress and try to keep case rates down there as well. It's another reason why, if you're not sure whether to get vaccinated, given the high rates of hospitalization, now is a great opportunity to do so.
Thank you.
And I will just note that we are closely tracking our cases. They are actually going down. Our hospitalizations have been slightly dropping. And I think it's really important to remember that part of our whole vaccination strategy was to go to those groups at greatest risk of serious illness and death first. And despite the fact that we have had recently these high case rates, our recent death rate has not been high. We still rank in the top rankings of states in terms of our death rate, even in the short period of time where we've seen this elevated cases. So of course, we're concerned about the hospitalizations. We will work every single day to try to get people out of hospitals, back to their homes, and on a path to recovery. But I do think it's important to recognize that we have not seen the equivalent increase in deaths from COVID-19 in this past month, and that is due to our vaccination strategy.
And the final question for the afternoon goes to Morgan from WABI.
Everyone, thank you for taking my questions today. First, we were looking for some clarity about masks being worn outside while eating and drinking. Are those the same requirements as indoor requirements? And when there's like a takeout situation, walking up, do you need to be wearing your mask? Do you need to be wearing your mask while eating and drinking outdoors?
Okay, so while eating and drinking outdoors, no mask is needed. Part of the general no mask needed outdoors in general. And then while you're walking up to a takeout window, I think I go back to what Governor Mills has mentioned on a couple of occasions, numerous occasions. I think it's good to be sensible there. If there's a long line of folks and there's no harm in putting a mask on, but in that situation, given that if it's a walk-up window, you're outside, no mask is needed. But we're not throwing courtesy and common sense out the window. There's always a room for those things.
And then also wondering about, as we get into the busier season, we are hearing from businesses that are struggling with their workforce. Some are having to temporarily close their doors for a day or more, possibly considering permanent closure. Some are thinking, some thoughts tossed around are some states declining federal unemployment benefits. Could that help drive the workforce? What are your thoughts on helping businesses who are struggling now to find workers?
Let me start to answer that question. We announced a week or so ago 2 things for people on unemployment. There's about 44,000 people in Maine right now receiving some form of unemployment. Come May 24th, the work search restrictions are tightened. So when someone is offered a job, if they're on unemployment, receiving unemployment, and they're offered a job that is suitable for them, for which they're qualified, they have to take it. And there's a hotline, a website for people to report if they feel there's been a violation of that. We're also using the community college system and other training venues to skill up people. There are a lot of people who are unemployed as of last year due to the pandemic who were fairly low wage workers, and we're trying to get them skilled up to do higher level work and get better paying jobs. Secondly, we're trying to get the word out to people on unemployment that they can go back to work with substantial part-time hours, sometimes nearly full-time work, and still keep the $300 stipend, the added benefit that the federal government is providing through early September. We want people to do that because they're able to earn more overall and contribute to the economy. It's a win-win for employers and working people. So we're trying to get the word out about those 2 things. Yes, I too hear from a variety of employers and through the newspaper and the news media that people are looking to hire and they're having a hard time finding help. That's happening actually in most every state, but we're concerned about that right now. And Commissioner Johnson has been talking to the hospitality industry in particular about how we can help fill those jobs.
Yeah, Governor, thank you. If I could just add to that, there are a number of things being done about kind of the structural barriers to how do we expand access to childcare? How do we expand access to transportation? A couple of pieces to try to make sure that, you know, people are able to get to the jobs they want to. We recognize that there are some actual functional barriers as well, and we want to do those in parallel to some of the elements the governor referenced as well.
I should add back on the issue of being able to go back to work and keep the $300 stipend. There's a calculator on the Department of Labor's website, so that if you're receiving unemployment benefits at any level, you can calculate how much you can earn and how many hours you can go back to work and still keep the $300 stipend. Very handy tool.
Great. Well, thank you, Morgan. And Governor, Morgan's question was the last one for the afternoon. So I'll turn things back over to you.
Well, great. And I think this is good news for a lot of people, not just businesses, but the general public in Maine. The people of Maine, we're doing so well getting vaccinated. We don't want to let down our guard now. We want people to get shots in arms. Just to recapitulate, March 5th, we first announced changing the travel restrictions. March 26th, we opened bars and tasting rooms and lifted or elevated the indoor and outdoor capacities, gathering capacities. April 27th, we lifted the face coverings in outdoor settings. And May 1st, we exempted all states from travel requirements, travel restrictions, other than potentially some states who might be on the danger list, which there aren't any right now. And today, finally, we're lifting the indoor and outdoor capacity limits and lifting the 6-foot distancing requirements indoors and outdoors, except for when in a restaurant or bar where people are eating and drinking and so not wearing masks. The masking requirement remains for indoor venues, just to be clear here. So I'm pleased with this news and this announcement. It's going to take effect before Memorial Day. So there are a lot of things that people can do Memorial Day, whether you're visiting or living here, working here. Every step of the way, we've been following the science, not the politics, but the science of this pandemic. And we want people to enjoy the great outdoors. Summer is coming upon us and the tourist season is coming down on us now soon. And we're excited for our economy to recover and not only survive, but be fully revived. And we want Maine people to use good common sense in conducting their activities indoors and outdoors. And please buy Maine, go patronize Maine businesses, buy Maine products, be good to your own state. Thank you very much for listening.
Thank you very much, everyone. Have a good afternoon.